Well, I'll just start. The Fisher-Wallace Laboratories, we're a wearable brain stimulation company. We have FDA clearance to treat depression, anxiety, insomnia, as well as OTC approval in Europe, Brazil, Mexico, and Canada. We started around 10 years ago commercializing this. We have 50,000 patients at this point, we're working on 50,000 patients and 9,000 prescribers. About a third of them are psychiatrists. Thank you. And the patient wears, here, I'll show you a picture. This is the device. Patient wears this 20 minutes a day, ideally twice a day. If you're just treating insomnia in the evening, but typically morning and evening. Insomnia is a diagnostic criteria of depression and anxiety. So if you're fixing sleep, it's really the gateway to fixing a lot of things, not just mental health, but chronic disease as well. And we've done some research of note. In 2015, we published this trial on bipolar II depression at Mount Sinai with Igor Galenker as a principal investigator. He runs the Family Bipolar Center there. It was a small subject size, around 16 patients. It's really a pilot study. But it was double-blind, placebo-controlled with a crossover design. So as you can see here, there's a big effect size. And then you can see that by the end of week 2, the placebo device group went back to baseline just after week 2. The active group continued to improve. And then we crossed over and treated the placebo group with active, and they had the same downward curve as this active group here. We also did a 392 subject study at Phoenix House on opioid rehab retention. So really we were looking at the standard of care versus standard of care plus our device improve the rehab retention rate, and it increased it by 50% at the 90 and 180 day points. So we're really now beginning to focus more on sleep as our primary treatment modality. And we're in the process of funding a larger study, a 300 subject or so study on insomnia. And if the data plays out to kind of reflect what we know from the 50,000 patients that we have, then we'll actually have some definitive data, and that will, I think, obviously help us get payer coverage, more provider adoption, and so forth. But one of the questions that I've been thinking about over this year and the last couple of years is, aside from kind of hiring a sales force that's going to go out to doctors and educate them and try and inspire prescriptions for this, how do you kind of technologically scale a device like this? So the first step, and we're just starting to do this with an engineering team at MIT, is we're turning our board technology into a system on a chip, essentially. It's going to cost about $500,000 to do that. But once you have a chip that size, it's smaller, obviously smarter, and is much less expensive than board technology. So it'll really bring the device cost down. And then the exciting part, I think, as well as that, is embedding this technology into other devices. So hospital beds, for instance, if you look at the Hillrom site and you pull down kind of all the clinical benefits that the bed provides, sleep is actually not one of them. Insomnia treatment would be an amazing thing to get into a hospital bed. You put a chip in there, and all the nurse would have to bring is the electrode headset, which could be disposable. Airline seats, cell phones, autonomous vehicles. This one, I believe, is the Volvo prototype. That's basically a sleep cabin. So this is where we kind of plan on scaling our technology. We did this combination with VR as really a proof of concept of that. So the concept of what are different devices that we can combine with. So we didn't have the chip technology yet. This is still the board device. You can see it resting on his lap. But we combined our neurostimulation with VR, which we're going to demo in a second. And Baylor conducted a pilot study of 20 active duty police officers at the Garland Police Department. We just got finished with it. I expect it to be published. I can't talk about the results, but I'm very excited for the data to be shared. And we combined it with a game called Landzen that you're about to see, But we're kind of view the content, we should be kind of content agnostic, and there's a lot of exciting content for mental health coming out, whether it's out of Adam Gazzale's lab, or there's a whole host of companies working on content for mental health, and we feel that if you can add a sleep intervention on top of that kind of seamlessly, you're going to improve the outcomes. So we did work on a new form factor. It's a little bit different than what was sitting on the policeman's lap, and we've called this Cortex. And now, if Michal wants to come out, I can give you a demonstration of how this works.
Wait, not yet. Let's make sure I live through.
So we can unplug that. I think that's the. No, we want to keep that plugged in. It's ready to go. Yep.
I've been told it's FDA cleared.
Yeah.
So.
Yeah, one thing I want to note is that we do have a wellness indication for this as well, a wellness claim, which is stress and sleep management. So we do, with Cortex, we're actually able to clone the prescription strength technology. And as long as we say sleep management and not insomnia, it is a wellness product, doesn't require a prescription. And so that is one way that we are commercializing it for certain things, like you would with an airplane seat, whereas with a hospital bed, you would more likely use the prescription version so that you can bill for it.
I'm starting to feel a little claustrophobic.
Okay. So I'm just gonna slide this on here. Are you seeing anything in there yet?
I'm in a room by myself.
Okay.
Walk this way.
Okay. Okay, it is on.
And Kelly has confirmed that I have very conductive hair, so.
So do we have a feed on the VR? Yeah, here we go.
Oh, there we go.
So this is really a focus and concentration exercise. The police are using this kind of wind down from their shift. There are various puzzles to solve, and you can see it uses left eye tracking, so it doesn't require any hands. You can be hands-free, and you just kind of look where that blinking light is, and it'll take you there. Yeah. Let's see if you're able to get through the door here. I see we're running out of time, so let me wrap this up. But let me maybe stop this. You can just give a quick impression of what it felt like. Let me stop you there.
All right.
Okay.
Got it.
Okay.
Whew. Oh, sorry, guys.
How was it? Okay.
Yeah, it's so everybody could see what I was seeing. Not as immersive, I'm sure, but it is very relaxing and very engrossing. And I know we don't have time, but one of my questions with VR and some of the health applications is the addictive nature of it, because I don't even want to take it off. So I guess that's a good thing.
Yeah, I've talked to people that sleep in VR, so that's a whole different issue. But thank you very much.
Thank you so
everyone.
much. Thank you, Kelly.